My priority is number one, bridging the treatment gap, and number two is strengthening the linkage between the testing and ART treatment center. Number three is expanding the community ART delivery. Number four is tackling the stigma and discrimination, and this we can do by intensified IAC campaign. And next will be focus on acceptance and non-discrimination of PLHIV. And another important thing also is the engagement with the local leaders, the faith-based organization, the youth group, mainly to promote and support the altitude. And another important point is intervention for the key population. Next important thing is to strengthen and to collaborate with other health program, like we are collaborating with the TB program, then the maternal and child health program, and mental health, and all these programs mainly for holistic care. And another most important thing is the data driven decision making, to maintain the data and to collect the correct data and to monitor, and while monitoring, so that we'll get this evidence based planning as per the data, and to focus to the hard rich area, especially the Garo Hills.
So, where does as far as the HIV/AIDS scenario is concerned, where does Meghalaya stand in terms of prevalence?
Prevalence as of the published data, Meghalaya stands at sixth rank in the country.
So how alarming it is.
Yet it is very much alarming as of now, and it is a concern. And we are from our organization, we are trying our best how to combat this situation so that we can control this situation as early as possible, so that we can achieve the target to reach the target and to uh, be Meghalaya free HIV.
Though 90%, over 90% are aware about that they are HIV/AIDS affected people, but the treatment, over 79% only go for antiretroviral treatment. What is the reason?
Most of these people, although they have registered themselves and they know the status, that their HIV status, but most of them they are reluctant to treatment. Number one is because of their personal interest. Most of them they are healthy when they are early diagnosed. They don't have any health issues. They are asymptomatic. That's why they didn't come forward. And some of them they don't believe that they're having that disease, and they cannot accept that they are HIV patient. And another thing is their ignorance. The ignorance about the virus. They are ignorance about the treatment. And another important point is the financial constraint. If they are staying in a far-flung area, like the traveling charge, then the uh, uh, means the financial constraint, in many ways. So that also is a very challenging for them. And another important thing is the stigma and the fear of discrimination, and the myths and the misinformation regarding HIV infection.
The center has alerted East Coast Hills for a large number of injecting drug users as well as homosexual drug users. So, what would be your efforts to reduce the trend?
Now for that, actually we have a division which are taking care of the prevention, and we have the TI, the target intervention, which are looking after these high risk groups. So there are many organizations who are dealing with this high risk group. So they monitor, they link them to treatment, and they sensitize them for testing to come forward for the treatment, and they support them even like mentally, and in that way they these target intervention, they are helping those high risk groups.
The official data shows that more than 50% of cases are due to casual sex partners. So, what are the efforts to reduce this menace?
Uh, yes, as per the data, more than 52% they are the route of transmission is through casual sexual partners. Yes, this is very alarming, and for this this um, we have this condom promotion service. So, and this condom they are freely available, and these are kept in those particular area, in the particular hotspot area, so that it's easily access to them.
Another data shows that it is as per 2023-24 data, 52% cases. Second in the country after Chandigarh, as far as heterosexual casual partners are concerned. Is it because of lack of awareness on the dangers of the disease, or what are the reasons?
Yes, that may contribute lack of awareness, but as of now, we are having this intensified campaign. Then we have integrated campaign where we target both the general population and the high risk groups to come forward and to know the route of transmission, how they get infected by this virus, what are the ways and means so that they can register, they can come forward, they can take the treatment, and then they should be adherent to treatment also so that they can live a normal life by having the viral suppression.
Test before marriage was suggested by former health minister. So, do you agree to the suggestion, or how far it is acceptable?
No comments on this.
We're coming to another issue of since HIV/AIDS in Meghalaya was declared as an epidemic, is considered as epidemic. Any urgent measures to make the situation normal?
Yes, we are trying our best. Number one is decentralize this ART, because we are having this field worker. Then we are having those care support center who can help and who can reach those far flung area. Then we have also main OST center where those people affected with HIV, they can take their medicines from there. We are having the satellite OST center. Then we also have these peers navigators or peer educators who can help those clients when they are having any issues. And another important thing is that we are targeted this youth friendly program. In any program, any event, we always give the IAC so that the youth will be aware about HIV,
So,
so
since you,
that they come forward for testing, they come forward for testing, know their status, and they are adherent to treatment, and so that once they are adherent to treatment, then they will have this viral suppression, so that they'll have a normal life as other people also. And another one is this, we have to strengthen the IAC, as I told you. IAC is information, education, and communication. And we have covered the whole state, more than 740 villages. We have covered under this integrated IAC. And the main focus is to correct the myths, and also to brief about the danger of this disease. If they are not taking any treatment, then they may get like many other health issues. And another point is that also we transport we support the transport for those who are coming from a far flung area, so that they'll reach to this ART center so that they'll get their service.
so what about the female sex workers? I mean, certain pockets of the city or some districts. So, are there any initiatives to create awareness plus?
Yes, yes, we have those targeted intervention that female IDU. They are mainly those organization. They target them. They have a separate organization.
Also, since you are the new director, project director actually, are there any new ideas? I mean, new upcoming things. What are you going to do? Because December is coming, the World AIDS Day is coming. So,
The most important thing here is awareness. As some of the people still they are not aware, to make them aware that this is the time that they should take care of themselves when it is not too late. Once they are diagnosed with the HIV, they should come forward for treatment, for registration, and then they should adhere to treatment so that they'll not lost to follow up. That is the main target.
so how long it will take so that Meghalaya can know the figure can be reduced?
We just hope by 2030 we can achieve the target
That is a national target.
national, so we are in line with that.
So all the best.
Okay, thank you.